from starting from the hair loss or hair thinning, or the typically male pattern of balding that you see around menopause. It starts from there. Your brain is affected, wherein you have mood swings, you have anger issues, you have depression. So menopausal women in general are more prone to depression, and women around their menopause are three times more likely to develop depression as compared to a man of that age. So it's hair, it's brain, it's your skin, where typically this is something that we know or we talk of, that you have wrinkles, you have pigmentation, excuse me, you also have dry skin. So all of these things in the skin, not just the skin of the face, but your overall skin also starts showing these kind of symptoms. There is the teeth. I mean, the dentistry also has to play a role in menopause, because your teeth, which also depend on calcium, your teeth also start showing effects of loosening, falling, your going down in your body. Your heart is affected, your heart health is affected, your digestion is affected. So women who've had menopause are three times more, again three times more likely to have a heart attack as compared to a man of the same age. While a woman who's still having her periods has a one-third lesser chance of having a heart attack, because she's protected because of these hormones, estrogen and progesterone. Um, then the bones are affected, so the bone density starts decreasing. Our bones typically lose their mass or their density right after the age of 30. So after the age of 30 itself, our bones start getting weaker and weaker, and this process kind of accelerates towards your menopause, because the absorption of calcium goes low. And in bone, typically there are two types of cells, which cells making the bone, cells breaking the bone. So the cells breaking the bone kind of overtake the ones making the bone around the time when you're in menopause, which leads to weaker bones, which first can cause what we call as osteopenia, and can progress further to osteoporosis, wherein you can have fractures by a simple fall. So we say elderly women, we try, or even men for that matter, we tell them to take care of falls. And because we are worried that if they fall down, they might sorry, they might fracture themselves. In fact, they might fracture their bones. So what causes those backaches is also some amount of vertebral osteoporosis, or vertebral small vertebral fractures, or hairline fractures, which can also happen in the vertebra, the spinal cord, the bones, backbone, which can also cause a lot of backaches as well. Of course, the uterus is affected slightly. I mean, yes, the uterus also shrinks. It becomes a little smaller when you're in menopause. Something that is bothering all of us probably is this the skin flab or the belly fat, which increases, and that's because the fat distribution in the body changes around the time of menopause. The male hormones or testosterone, which is also there in our body, stays at the same level while the estrogen goes down. So we typically tend to shift from a female pattern to a male pattern of the body, because of which we have these because of which we have uh, more of fat distribution. If you see men, they typically tend to gain fat around their belly. So that's why we also have more fat around the bellies. Also, this testosterone that we have in our body is also converted to estrogen somewhere. So in the somewhere, meaning in the lungs, in the liver, also in the fat. So now that our ovaries are not secreting estrogen, the testosterone converting to estrogen is the only source of the small amount of estrogen that we have. And since that takes place in the fat, the body also tries to hold on to more and more fat for this conversion to take place. Then coming more towards the pelvic area, we have vaginal dryness, the vaginal flora, or the bacteria in the vagina change. The bacteria in the gut also change, because of which we have these digestive issues. So because of the changes in the hormones, and because of the decreased lubrication that we have, because of the thinning of the layers of the vagina, or the mucosa of the vagina, we have there is a decrease in the normal flora or the good bacteria inside the vagina. There is dryness of the vagina, there is pain when you have intercourse. This pain during intercourse is what the body or the mind anticipates every time you're having sex. So that is also one of the major reasons why a lot of women lose their libido or have a lower libido around menopause. because the mind starts anticipating sex with pain, and that is where the libido goes down. So that's also something which affects women around this time. Then coming to the urinary bladder, so there is incontinence. You tend to leak urine when maybe you are laughing or running or jumping. There are times when you also leak urine even when you are you want to go to the washroom, you're rushing to the washroom, and before you actually reach, you're leaking a few drops of urine. So all of these things are happening in the body. So it's not just the stopping of periods, but these are some of the symptoms that we actually have around the time when we have our menopause.
Um, Ameya, all
Yes.
of this sounds very, very scary, honestly, when I look at this entire list of symptoms. Okay. And it feels like so much is going to happen, and I may not have control of my own self,
True.
right? So, how do I even know that, uh, you know, that, so for example, some of these symptoms, right, are caused by a lot of other reasons also. How do I
Yeah.
know it is because of perimenopause that it is happening, or is it happening
Hmm.
because of I'm not eating well, or other things?
So I would say it's a combination of a lot of things. So it's a combination of the age. So whenever we're having menopause around the time when we're also aging, right? Some of these symptoms are also because of aging, like for example, bone loss, right? Osteoporosis. Do men have osteoporosis? Yes, they do. They may not have it as frequently as women. So out of 10 people, I mean, osteoporosis is 4 times more common in women than in men. So so men also have osteoporosis because of the aging process. So aging and menopause kind of occur at the same time, because of which it's kind of I would say difficult to distinguish, or I can't tell you, this is because of aging and this is because of menopause. Difficult to point out that way. But what we do when we think of these symptoms, I mean, when we say about if it's about deficiencies, even during menopause, what we want to do is we want to test a lot of these hormones, right? So we want to, for example, loss of energy, so, or feeling tired, that is also a symptom of menopause. And that can also happen because of because of higher levels of TSH, or because of hypothyroidism. So whenever we have anybody with all of these symptoms, we want to test everything, right? Tiredness can be because of hypothyroidism. Tiredness can be because of low vitamin D or vitamin B12 levels also. So the first step is to rule out the all of these other causes which can cause these problems. So for example, even if you have irregular periods, right, what the doctor will do typically is ask you to get a sonography, a thyroid test, and a prolactin test. So we want to still confirm whether the period irregularities are because of your menopause or perimenopause, or are they because of your high prolactin levels. So the first step is to rule out the other issues that also might cause these symptoms. And if all of these are normal, then we can say that yes, it is because of perimenopause. Can we test for FSH and LH like I spoke about at this time? Not really, because these hormones they fluctuate in the whole cycle, right? So FSH is higher in the first half of the cycle, then it goes a little low. LH kind of peaks in the mid cycle. So these hormones keep fluctuating, the levels of these hormones keep fluctuating. So testing for hormones may not be the correct way to understand if you're in menopause. It can give you a fair idea that yes, if your FSH is maybe, in normal levels should be less than 10. So if it's maybe more than 10, it's around 20, yes, you are close to menopause. If it is more than 40, yes, I can say this is menopause. So 40 is like the figure which we say is more than that is menopause. But if you're having symptoms and irregular periods, your FSH is going to vary here and there. So testing for these hormones may not be necessary, but testing for other things like thyroid, etc., is something that we do to understand why you're having these symptoms. I think there was a question.
Dr. Amaya, I have a slightly different question. Although, first of all, thank you very much for scaring us in the beginning itself. I'm through with my menopause, so my fear. I'm glad it's coming after the fact,
Yeah.
and I've experienced some of this and much of it actually. The change in skin was one of the shockers because the level of change. But one of my questions is, and this is because like the whole batch of my class is together in a WhatsApp group, right? And all of us were going through this. And
Mhm.
we were just like using abusive language to the Almighty
Right.
at one level. But like some people are saying frozen shoulder, it might be menopause. Rashes might be menopause. Allergy, I developed a cold allergy, and the doctor told me, the general doctor told me, "Oh, have you entered menopause? Okay, let's wait for 2, 3 years. Right now, just manage it with Allegra. Maybe it'll go." So, like a plantar fasciitis, maybe it's menopause. So, I'm just saying, like, where do we draw the line?
So, I mean, when you talk about this, there are some, I mean, some places, if you search on the net, the number of symptoms of menopause, some people say 35, some say 52, some say 55. So, I didn't talk about 30 or 50 symptoms either when I spoke about that, right? So, I mean, something you spoke about skin, you spoke about rashes. There are allergies which crop up. You suddenly start, reacting to wheat, which you have been eating all your life.
Gluten intolerance, also
Gluten
somebody
intolerance
says
can also
now.
present at this point. It is there. You have that intolerance, but it presents at this point in time. I'll tell you something. Itchy ears is also one of the symptoms of menopause. I
Oh
mean,
my,
if I have itchy ears, I think the first thing I would do is probably put some, oil, or maybe I know I put some those drops, Solivax and stuff. I think there's some wax in my ears. Maybe visit an ENT surgeon. But itchy ears because of, again, dryness of the skin, right? The skin, the skin inside the up to the eardrum also. So this drying and the changes in the skin there can also cause itchy ears. So various kind of symptoms could be there of menopause, and that's why I say everyone's menopause is different. I mean, I may have hot flashes. You may say, "Oh, I don't know what are hot flashes." Someone may say, "I have rashes." Someone may say, "I just have vaginal dryness." So every body is different. Every person is different, and everybody can have a very different kind of menopause. What helps is to understand that yes, this can also be because of menopause. So that is something which helps us to come to the, I mean, and when you say that your doctor said, maybe just deal with it, or we go through it, I wouldn't say that could be the symptom, that could be the solution. Actually addressing those symptoms in a correct way is something that we can do. And when I say this, I mean that, I mean, talking of myself as a gynac, I would say maybe 5 years ago, did not know that itchy ears is a symptom of menopause. Or I was not, I mean, any gynac, if you see, who's not actually, has not actually dealt a lot with menopausal patients or menopausal issues. Because when we are getting our training throughout our residency or throughout our MBBS times, menopause is never like a important topic that we talk about. Hormone replacement therapy is not what we have seen our seniors prescribe. And typically, how we doctors learn is through our residency by actually treating patients rather than just reading these books. So, most of the things that we do today are what we have seen our seniors practice. And this is not something which we have seen our seniors practice. I mean, this is not just in India, mind you, this is all over the world. So, even people abroad are saying that, I mean, even doctors, gynacs abroad say that our curriculum does not give the correct importance or correct weightage to menopause, because of which a lot of doctors do not, a lot of gynacs do not know a lot about how to manage menopause, because we've never done it actually practically. So if gynacs are not knowing about menopause, I do not even expect the other specialities to know much about it, right? I cannot expect a ENT surgeon maybe, or a surgeon or a physician to know a lot about these symptoms or managing these symptoms. So
Thank
Hi,
you,
Dr.
doctor.
Ramaya.
I would, I'm sorry to cut you. Go ahead. Who was this?
no, no, please go ahead. Yeah.
No, there was somebody asking a question. Go ahead.
Did you please go ahead? Like I had a few.
I was just scrolling through the chat, and there's one question which fits in here. We will take, multiple people have asked, how long do these symptoms
Yeah.
last, and do they stop after menopause?
So we have different studies giving conflicting results, so
Mhm.
some of these symptoms do stop. So hot flashes typically on an average, they last for around 6 months to 2 years, but that is around your menopause. So hot flashes would typically go away slowly after those 2 years. Unfortunately, we've had patients who have had these symptoms for a longer time, maybe up to even 10 years their hot flashes have lasted. But typically, hot flashes would go away. Vaginal dryness is something which slowly would increase as you go into menopause, because those changes in the vagina, in the mucosa of the vagina, kind of tend to what do you say, multiply when you are going out, because a long time no estrogen makes the mucosal lining very dry. So some things like hot flashes might improve. Some things like vaginal dryness may actually start after menopause. Some things like anger or mood swings typically tend to settle down. some things like memory issues may actually increase to more after your menopause. A recent study which has been done, by the I think in by the International Menopause Society, etc., says that people who have had hot flashes are more likely to experience memory loss issues as well. And they did the MRI studies of these women who had hot flashes, and they noticed some white matter hyperintensities in the brain. So an MRI finding which is related to memory loss or which is related to mind fog as well. So people having hot flashes or vasomotor symptoms, as we call it, may be more likely to have these brain related symptoms as well. So some of these symptoms get better, some may not. But of course, yes, please go ahead. You're saying something, Ruchi.
I was just talking about my experience of the brain fog. I'm sorry I cut you because again, I have gone through my menopause. I'm done, and I know that I have shared this with a few of my friends. And in our call while we were preparing, my most single embarrassing moment in corporate life was as a general manager in Samsung, standing in the middle of senior leadership, presenting, and I'm not kidding. I didn't remember anything. It has never happened to me before. It's never happened to me after that. I'm sweating and I don't remember anything of the slides that I have prepared.
Yeah.
And I didn't know what to say. I don't know how to address this, right? And all I said was, I'm a little unwell. Can I hand it off to? And I named another person,
Yeah.
and I went out. Maybe now that I'm mature, I would have asked for a break or whatever, but I didn't. And I think for working ladies, it's important to understand how to manage this. I didn't know it was even related to menopause. I was just shit scared.
Exactly,
I was
exactly,
just shit scared.
yeah.
Yeah. So yeah.
So some of these, I mean, one way that this could change or this could improve, or I would just say change, is that when we start talking about it, right? So we've started talking about menopause recently, I think, because a lot of Hollywood celebrities also spoke about it. I don't know if you follow Tamsin Fadal on social media, but she's a news anchor and now a spokesperson for menopause. So Ruchi spoke about a similar incident that she had. She's a lovely speaker and she's been a news anchor all her life, and she talks about this one incident when she's like, I just couldn't see the screen. They have a scroll when they say the news, and she's like, all those letters merged. It was all blurred. I just couldn't see. I just couldn't read out what was in front of me. I went to the washroom to kind of freshen up, or put some cold water on my face, and I fainted in the washroom. I fell on my face. So this and that time she didn't know that this was because of menopause. So again, she also tried to understand why this happened, and today she knows, yes, it was a hot flash, it was a moment of hot flash and mind fog that she had. But I think this can happen to a lot of us. And this, I mean, knowing about it, talking about it, and actually saying that, I mean, excuse me, I'm having a hot flash. Because I mean, I can imagine what you must have faced, Ruchi, because you are typically, people are going to think that, oh, she's anxious, or oh, she's not prepared. So we always have this at the back of our mind, right? What will the other people say? Because if we do not know about what's happening to us, we cannot expect the other person also to understand. But if we actually articulate and speak about it, yes, I'm in menopause and I'm having a hot flash, and if we regularize the conversations around periods, menstruation, and menopause, and all of these things, I think it could be much better. Course, things are getting better. I remember when I was in school, we had a chat, we had a talk to the daughters and their mothers about about periods. And one question that was asked in that session, one mother asked, my daughter has periods and she comes home in the evening and she wants to sleep because she's having pain in her abdomen, and her father comes home at the same time. So what do I tell the father? And I mean, even at that time, my dad spoke to me about my periods. I used to have terrible dysmenorrhea or pain during periods when I was in school. I used to puke and I used to have pain, and I have gone home from school some 7, 8 times because of this. And once my parents were not available, and I had to call my uncle, my mama. And I told him that I'm going home. I'm not, I mean, the call went from my school that please pick her up. She's not feeling well. And when my mama came to pick me up, I said, I'm having my periods and I'm having pain. And he was totally okay, cool about it. Oh, you're having periods. Okay, let's go home and rest. So, I mean, talking about this has become much more common now. My niece has just had her periods, and my brother-in-law, her father, spoke to her openly about it, and she actually had her periods for the first time when her mother wasn't around. So she came and told her father very openly, "Oh, I think I have started having my periods." So her father went out, bought a pack of sanitary pads and gave it to us. And asked her if she knows how to use it. And she did, but he was also prepared to show her how to use it as well. So these are normal things, and if we start talking to our children about periods today, we can talk to our they can talk to us about our menopause when we are going through our menopause as well. So talking about it, conversing about it, I think is one of the ways we can probably normalizing it is something that is going to really help us. Um,
Dr.
then I
Ramani,
yes,
oh,
please.
and first of all, thank you so much for, talking about something so personal. I mean, it is really powerful, and to just see like how much just talking about this can help so many of us. So I just had a follow-up question to all these symptoms. So can you apart from like just you gave the example of hot flash and how just talking about it helps. So are there any other examples of common symptoms wherein what to do in that moment? Like
Yeah, yeah,
so many of us actually are talking about like, oh, I got to know that that was a hot flash, but
right, 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 right.
something in the moment, things to do.
Definitely. So if we talk about managing some of these, so managing any kind of a medical condition typically has medical interventions. Yes, we have tablets, we have different ways in which we can manage these symptoms. Also, what helps here is lifestyle change. So lifestyle change can actually help us to manage a lot of these typical issues. And before I go to managing these singular symptoms better, and there are ways wherein how we can manage those, a generalized way which we can look at it. I think menopause kind of has given us a positive way of looking at it. Is menopause has given us an opportunity to look back on our life and modify our life and make us healthier as we age, or as we go in that one third part of life which we are going to spend in our menopause. So sometimes we need that push from coming from somewhere to improve our lifestyle, because early 20s, early 30s, we are rushing everywhere. uh, our health is okay, right? So it's okay to have junk, it's okay to stay up late at night, binge watch movies, or binge drink. We've been doing all of these things, and this is an opportunity for us to actually improve. Just like I would say COVID was horrible, and we lost some really lovely people that time. But COVID, for some, has given an opportunity to actually go back, reflect on their lives, and improve their lifestyles also. So menopause probably can do that for us. So when I talk about lifestyle modifications, I mean, there are so many things that you can do. You open your social media and you will see 100 things which are coming up. Your gut health and this and that, and how do you take care of your skin, and how do you exercise, and what kind of strengthening and pilates. So many things are there, right? So just to summarize it up, I would say there are four pillars of lifestyle modifications, I always say. So one is your nutrition, second is your exercise, third is your sleep, and fourth is your stress. So nutrition basically means eating. When people are pregnant, I tell them, what they ask me what to eat. I say that when you are eating, think that this food is giving. Ask yourself if this food is giving nutrition to me and my child, and you will decide what to eat based on that. So if you're eating, I mean, you can eat what you want, but if you just feel like eating, if you have cravings for Maggie, for example, I mean, that's not healthy. If you have cravings for biscuits, ice creams, they're not really healthy for you. So somewhere deep down, we know what's good and healthy food for us. For us Indians, luckily, we have home cooked food which we can always have, and that is also something that is traditionally passed down to us. And to just make things extremely simple, have the kind of typical home cooked food that you've been having so far. So simple way to manage your gut health and to help your, I mean, I would say migraines and all these other things, probably even your menopause symptoms, would be to eat the way you have been eating since you were kids, the way you've seen your grandmothers eating, um, and stop accessing all these junk foods, and and stop resorting to Swiggy and Zomato as less as you can, right? So that is how nutrition is important. Nutrition does not really just mean eating salads. It does include, sorry, a normal food also. But when you eating it, think about whether this is giving me nutrition or not. Second thing is about exercise, something really important. Exercise has so many benefits, and it's not just about weight loss or body toning, or something like that. It even starts in the brain. So exercise makes you feel happy because it releases these happy hormones or endorphins. So starting from making helping you to feel happy, to improving your brain health, to improving your brain blood flow, to decreasing the amount of brain fog you may have, uh, up down to the level of improving your heart health, your muscle health, your bone health. Exercise has multiple ways that it can help us. So exercise, and what kind of exercise? I mean, I would say both aerobic and anaerobic exercise, which means both aerobic, or running, walking, jogging, swimming, aerobics, Zumba. All of these are forms of aerobic exercises. They help to improve your stamina, help to improve your heart health. Excuse me. Something like strength training, which is improving, which helps us to improve our muscle and bone health also. It also helps us to decrease, yeah, decrease the insulin resistance that may set in at this point in time. So all of this is going to be addressed by strength training or weight training. Weight training may not always mean just lifting weights in the gym. It also may mean something like yoga, wherein you're using your own body weight as well. So exercise, and how much exercise? Again, one more very common question. For fitness, or for maintaining your fitness, we recommend, or WHO recommends 150 minutes of exercise per week, which comes down to around 30 minutes per day. But this is something which is for maintenance. If you're actually looking for making a change and improving your health, or losing that fat that you've been gaining, then that 30 minutes per day increases to 45 to 60 minutes per day. So either 150 minutes of moderate intensity, or 75 minutes of high intensity exercise per week, which is done for fitness, but a little more than that needs to be done for your weight loss, fat loss, or to make that change in your body. The third pillar of sleep is something that we very often ignore, because we take it for granted that I can manage if I just sleep for 4 or 5 hours, is what I'm okay the next day. But then slowly it's somewhere affecting your health. It's affecting your brain health also. A lot of studies to show that less amount of sleep affects your actually affects your brain as well. So a lot of things, I mean, a lot of times we have not slept enough. We may have had more, I mean, less efficiency the next day when we are working. So around 7 to 8 hours of sleep every day is something that is recommended. Of course, every person is different, and some may need 6 hours, some may need even 9 hours. But on an average, 7 to 8 hours of sleep a day is what you need. And it's not just the amount of sleep, not just the quantity of sleep, but also the quality of sleep that matters. So it's also a peaceful sleep, and you can get that peaceful sleep when you are not watching your screen before you go to sleep. I think every one of us here, is including me, is guilty of this, that we tend to look at our phones at the end of the day and just before we sleep. But and it sometimes we do feel that I sleep by watching the television helps me to sleep. But it's not really that. What is happening is it's actually exciting your brain. The blue light being emitted from these devices, from the phones or tablets or laptops, is something which is actually stimulating your brain. So your eyes may get tired, you may want to sleep, but your brain is actually getting stimulated, which affects the quality of sleep that you have. And just 7 to 8 hours of poor quality sleep is also not going to give you the results of a better efficacy the next day as well. The fourth pillar is stress reduction. So you cannot really change the amount of stress that you have in your life. You can't always change your job, your life circumstances, etc. But what you can do is you can change the ways in which you're managing the stress. So you can change the way, in which, like for example, it's not just this kind of meditation that's always going to give you that calm. It also could be spending some time with your hobby, right? You've been always wanting to do gardening, painting, dancing, whatever might be your hobby, right? Spending time in your hobby for yourself, your me time, self care. Something like that is also going to help you to calm down, for your mind to calm down, for you to de-stress. I would say, if you have to think and if you don't have a hobby, I would say just put off your mobile, or put your mobile on that do not disturb mode, and close all devices around you, and sit without, I mean, de-device yourself for 15 to 20 minutes a day. And that also can give us a lot of calm, and that can also help us to de-stress, because this constant stimulation, see, I mean, I'm talking to you right now. I think you heard my phone ring with messages some 4 5 times. Now, because I'm talking to you, I didn't look at this, but otherwise I would look at my phone every time there's a small thing going from my phone to give a message. uh, the message may not be really important at that point in time. I can look at it after 2 hours also. But I mean, we're so accustomed, we are actually, our minds are trained. I mean, you can't resist yourself from looking at the phone if there's a message coming in, because you want to see who it is. So this constant stress that we've been having, that constant awareness, constantly being on your toes, that kind of stress is something which is also affecting us. And all of these things, increased amount of stress, less amount of sleep, less amount of exercise, the poor diet that you've been having, all of this kind of magnifies the symptoms that you may be having at menopause. So taking care of all of these things can actually help you to manage these symptoms better. In fact, some of these things may be actually getting affected because of menopause. So sleep is something that can get affected around your menopause. It could be the hot flashes occurring at night, like night sweats, which are giving rise to poor sleep. Or it could just be, I mean, for no reason you can't sleep, you keep on getting up at night. So this is also something which happens at menopause. How can you handle it? Of course, yes, we have medications, but the natural or simple way you can start handling it better is by stopping, I mean, not looking at your phones at before you sleep, having a sleep routine or a sleep ritual for yourself. You put your babies to sleep. You give them some food, and you give them a bath, and you change their clothes, you tell them a story. Have some sort of a routine for yourself. Maybe you're taking a shower, maybe you're having a glass of milk, maybe you're having a glass of water, you're dimming the lights, and you're lying down on your bed and slowly going to sleep, right? So unwinding yourself before you sleep is also going to help you to have a better sleep. So one of those specific symptoms that we can speak about is sleep. And uh, this thing which I said right now is what we call as sleep hygiene. So maintaining that hygiene around sleep is also going to help us to manage your sleep issues. Looking at some other symptoms and how can we deal with these other symptoms, something very common. So hot flashes incidentally are the commonest symptoms that people face around menopause. And when we started Elda Health, when I was that time, I also, like the other gynacs around me, I did not know a lot about menopause. I went for I had to get to do a course from the Indian Menopause Society, wherein I learned, I studied more about menopause as well. So that time I remember talking, reading this, that it's a hot flashes are the commonest symptoms around at menopause. And I was like, it can't be true. I've never had a patient who has come to me and said, "Oh, please treat me. I'm having hot flashes." And maybe I thought, maybe I don't have that kind of experience. So I spoke to a very senior army gynac who's been a gynac for the last 35 plus years. And I said, "Uncle, I mean, maybe it's my inexperience, but did you have people coming to you saying that, I have a hot flash, can you please treat me?" And he's like, "No, I've never had a patient who's come up with a hot flash." Probable reason is because all of us as women also do not know what, like Ruchi said, right? She didn't know what she was going through at that point in time. So that was a hot flash which she knows today. But many people don't know that this is something which happens around menopause. Many people don't know how to manage it, or how that this can be treated, that this has a solution. So what can you do when you have a hot flash? So something which can, I mean, I have changed my wardrobe from synthetic clothes to cotton clothes, right? So cotton clothes is something, cotton absorbs heat better, absorbs your sweat better, and it makes you feel more comfortable when you're if you are going to feel hot or sweaty. So clothing, the type of clothing that you wear, what we often say is, especially for people living in colder areas, rather than wearing just a big sweater as your top, maybe, as a t-shirt. Wear something inside and wear a jacket on top of it, so that you can remove that jacket when you're feeling hot. So layered clothing is something. You wear instead of wearing a polo neck t-shirt, wear a scarf. So if you're feeling hot, you can remove the scarf. Something like that, right? A layered way of clothing yourself is something which can help you to manage those hot flashes when they affect you. uh, People can have hot flashes at various times. The triggers could be many. It could be hot food, it could be spicy food, it could be just an anxiety of going out, stepping out of the house. What you can simply do is always carry wet wipes in your purse. Carry a hanky in your purse, or always. I have this I have this small fan that I carry with me all the time. So anytime I'm feeling hot, I can just put it on, and people are very curious. So, what are you using? But this actually helps me to manage my at that moment much better. A lot of such things are available even on Amazon. So you can have these. You can just carry these kind of things with you to manage yourself better. No fan, you can simply take a paper, and that is something you can always carry along with you. Something medically that we also advise is what we call as spaced respiration. So it's basically a yogic method of breathing, wherein you are taking very slow breaths, very slow inhalations, exhalations, with the exhalation being a little longer than the inhalation. So maybe 6 to 8 breaths a minute, with maybe, if you're inhaling for 5 seconds, exhale for 7 seconds. So something like that. It's a deep, slow respiration, which is abdominal breathing. Keep a hand on your abdomen to see, excuse me, the abdomen rising. So this kind of paced respiration actually activates your parasympathetic system, which helps you to cool down. So this practicing this as a routine for 10 to 15 minutes every day, and also when you're actually having a hot flash, is something that can be helpful. Managing your own temperature, especially when you sleep at night, right? Try to maintain the temperature of the room in a better way. So maybe put on the AC, the fan, open the window, whatever is possible for you. Something which we also advise for people having a hot flash. You can actually keep a ice pack below your pillow, so the pillow becomes cold. And a hot flash typically comes from the neck or the back, of the upper part of the body. So a cool pillow can also help you to have a good night's sleep in case you're waking up because of these night sweats a lot. Rather than a big thick blanket you take while sleeping, take a thinner blanket, which will or a sheet which can help you to not feel very hot as well. And like I said, keep a fan handy. And the one thing I haven't mentioned here, but we spoke about, is be vocal about it. If you're having hot flash, you can actually say that I'm having a hot flash, so please excuse me, I need to go to the washroom to wash my face. So it's okay to say it, and there's nothing to feel embarrassed about it when you actually have it. So commonest symptom was hot flash. Something else which also affects us a lot, and uh, they say beauty is not just skin deep, right? So it is, even if they say that whenever you have changes in your skin, you don't feel good about yourself. One, secondly, some changes could be very troublesome, like Ruchi mentioned, right? There could be, if you're having rashes and if you're having allergies, that is something which is actually troubling you. So these things can be managed by medications, of course, but how do you manage that dryness of the skin that you have, those pigmentations that you have? I would say, first thing, all of these women here are beautiful. So change the standards of beauty. A clear porcelain Korean type of skin is not the only skin that's beautiful, right? Every one of us is beautiful, and you're all beautiful from within. So losing that confidence over a bad skin, rather than that, accept that yes, something is happening to me, and I'm completely comfortable with it. Talking about how to take care of your skin, they say three things, cleanse, moisturize, and use sunscreen. So cleansing every day, cleaning off the dirt from your face. Air quality index is bad, so is the dust around us. So all of that tends to fall on the face and stick to our face. So cleansing the face is going to be helpful. Moisturizing, because even if it's hot, even if your skin is not very dry, your skin does need a little bit of moisturizer as well. Third thing is sunscreen. And I've had a patient asking me that, is it for real, or is it just the sunscreen industry, or the cosmetic industry trying to up its sale of sunscreens? But I think it's for real, because the kind of sun rays that we are exposed to these days are not really very clean, the ozone layer depleting, etc. So yes, we do have a lot of UV rays in the sun. Even when you're at home, right, the normal lights that you have, they also emit energy or light which can actually start damaging your skin. So skin damage because of sun exposure is something for real. So yes, using your sunscreens daily, reapplying them 4 to 5 hours and applying them even when you're at home is something which can help to keep your skin better. Caring for your hair, by that I mean that it's okay to spend that time every, maybe every week, every month, whatever you want, in the parlor where you just go for a head massage and take care of your hair. So spending that time in self care and taking care of your hair is something which is really going to help you to have good hair and better skin as well. Of course, we have medications for it. First thing which we do when we have these issues is we check for deficiencies. Like for example, iron deficiency can cause hair loss. So like I said, right, first we find out the other causes. So just as we're checking your vitamin B12 levels for energy, you're also checking your iron levels too if you're having a lot of hair loss. So it simply could be low iron levels which are giving you that hair loss. So checking for these deficiencies is important. And of course you can see a dermatologist, wherein a lot of products these days are available to help to maintain and manage your skin texture and luster as well. One more common thing that people have is brain fog. You just forget. And again, when I think back, I remember one day in the morning when we searched everywhere for the scissors in the kitchen, and we found them later in the freezer. So my mom was having one of her mind fogs maybe, and we just couldn't find the scissors. So yes, this has happened with a lot of us, or we've seen this happen with a lot of our elder people, our parents, our elder sisters, or anyone maybe. So how do you manage that? I think writing down important things and sticking sticky notes everywhere is something which can help you. Keeping, I mean, sometimes just forgot to do this thing. I have to do it today. We have phones, so using our phones that way, keeping alarms for smaller things is something which can help us to tide over these things when you are having a lot of fog. Talk to your colleagues about it. Yes, I mean, this is something very embarrassing to accept. Yeah, I can't remember things, but yes, telling people around you that I'm going through this phase and right now I cannot remember these things, so please remind me if I forget this. So taking help from your colleagues is something which can actually help you in your workplace as well. What also helps is what I follow, try to follow is this Pomodoro method. Like you work for I think 25 minutes, take a break, and then you take a break of 5 minutes, and then you again start working. So when you I mean, if you're working for a very long time, you feel I can't think anymore. So that is some that you can stop your brain from getting fatigued by using these methods. So work for 25 minutes, take a break for 5 minutes, come back, work for 25 minutes. It just helps your brain to kind of cool down and work efficiently the next time as well. And when I talk about this, I give an example of our school or college. Our lectures or our periods in school used to always be for I think 35 minutes, so 5 minutes here and there. So that is the time your brain can actually concentrate on something properly. So I think that's what is important, right? So 30 minutes is where you can actually concentrate for at a time. So give your brain those kind of breaks. What actually helps brain fog, especially around after menopause, we don't have any medications for that really, but what can help is keeping your brain active by solving different kinds of puzzles. Could be a game of Scrabble, could be a Sudoku, could be any kind of a board game, could be crossword puzzles, anything. So any kind of puzzles, any kind of board games, all of these things help to maintain that those neural. I mean, not just talking about it, but this actually helps to maintain those neural synapses or those connections between nerves at a much healthier phase or place where when you are doing these challenging your brain constantly with different kinds of puzzles. Then I talk about social connections, because today we'd rather message someone than actually go and meet that person, right? So rather than that, go and meet people, talk to people. Man is a social animal, so being close to people, being close to people you like, is something that actually helps your, I mean, if you're happy with people around you, then your brain is also happy and you have lesser problems of these mind fogs. And this is not just what I say, but has been proven by a lot of studies as well. Again, exercise, exercise is something, like I said, so many multiple ways it helps us. So one of the ways it helps us is also in maintaining our brain health also, and of course calming your mind, relaxing your mind, giving that, as like I said, what do you say, devising yourself for some time in the day is also going to help you to deal with it better. The kind of stress, I mean, we say some amount of stress is good, stress in small amounts is good for us, because it's a fight and flight mechanism. It was developed because, well, if you're a calm, go back to Stone Age, and if you're very calm and when a tiger is in front of you, you're going to get just eaten. So you need that burst of adrenaline at that point in time to run away. So small bursts of stress can actually be helpful to us. But when it comes to constant stress like we are having today, that is when it actually causes the damage, and that damage shows. Now, whether mind fog is just because of menopause or because of aging, we can't really pinpoint. But yes, estrogen, there are estrogen receptors in the brain. And because of low estrogen levels, also we have these things happening. So it's related to both aging and menopause. And these are the things which can actually help you to manage your brain fog also better.
Dr. Ameya, thank you so much
What
for
else? Yeah, mood
sharing.
swings. Mood swings are something which all of us face, so many times it's that over feeling of being overwhelmed. Is it because of menopause? Yes, maybe because of that, because your threshold goes down. Also because you're always on the run, right? You're always doing something, not spending time with yourself, for yourself, trying to manage everything by yourself. So, I mean, delegating things to others is something which can really help you. So, there are some 4 Ds that people talk of. Delete things which you don't need in your life, delegate things to others wherever you can. um, I can't remember the other. See, mind fog maybe. I can't remember those other D's. If I remember them, I'll tell you. But 4 D's, one is delete things you don't need, delegate things that you can. So delegating those things to others can actually decrease the pressure in your mind. And when you delegate things to others, you should be okay with how they are doing that. You can't expect to delegate also and expect that thing to be done exactly like how you do it. So it's okay to let go of certain things. It's okay to choose your battles correctly and properly. So, I mean, lessening the amount of load on yourself and on your brain, spending some time for yourself, taking care of yourself can also help you a lot. And of course, a good sleep, by maintaining a sleep hygiene, getting adequate rest, and managing those vitamin deficiencies can also help us to manage mood swings much better.
Dr. Ameya, could you thank you for addressing all the symptoms. Could you also talk about medical management and where is hormone replacement therapy appropriate and any other
I will,
interventions
because
that can help as well? I think we
yes,
are almost close to an hour now, so
I know. I just looked at the watch, and yes, I've been
yeah.
talking a lot. But talking about, yeah, one more thing, joint pains and aches. A lot of us have these issues, uh, especially because we don't have good kind of chairs to sit on. So having ergonomic chairs, correct footwear. I think if your legs are not aching and if you're feeling your comfort level, or even your um, efficacy and the amount of work that you can do, your energy levels also improve. So correct footwear, I think, is really important. Elevating your legs when you come home from work is something that can help you. Stretching at yourself at work, right? A lot of simple stretches that you can do while you're sitting at your desk, right? Stretching this way, your hands, or maybe just stretching yourself up when you're sitting at the desk and working is also something that can help you. When I talk of the Pomodoro method, I talk about when you're taking that break for 5 minutes, get up from your place, walk around. Just don't sit and, I mean, when I say break for 5 minutes from work, it doesn't mean checking your mobile in those 5 minutes. So get up from the place, go out, walk, and come back. That also helps to keep the muscles and this thing very active. Um, Talking about the medical interventions and what you can do to manage this, I think we're over time, but some of these things I want to talk about is when you have unbearable symptoms, please go and seek help. If the bleeding is very heavy, it's not cleansing your uterus, it's actually causing uh, your body to lose that blood. So it's important to have talk to your doctor when you're having these things. Red flags around menopause: one is postmenopausal bleeding. Any bleeding that you have after you have stopped having your periods for 12 months, any such kind of bleeding needs to be evaluated correctly. Postcoital bleeding after intercourse could be because of some lesion or problem in the cervix or the mouth of the uterus. So post-coital or post-intercourse bleeding, something that is really important to check. So post-menopausal bleeding could be an early sign of endometrial or uterine cancer. Post-coital or post-intercourse bleeding can be an early sign of cervical cancer. So really important to get those things checked. Another thing I want to speak about is recurrent UTIs, because uh, sometimes we have these recurrent UTIs and we keep on taking antibiotics to treat them. But the main problem or the main cause of these UTIs actually is the vaginal dryness. So just as the vagina gets dry, the urinary mucosa also has estrogen receptors. That also gets dry, and that is what is actually causing those recurrent UTIs. So treating it correctly by hormones or by lubricants is what will help you. And when I talk about treating it with hormones, I want to talk about hormone replacement therapy, which is now called as menopausal hormonal therapy, MHT or MMT or HT. So what is it? I mean, is it going to give me cancer? First thing people are worried about is, I don't want hormones because I may get cancer. So a short story about this: hormones started being used in the US for the first time, I think around the 1960s. And that's when women realize, oh, these things, these medications can help me be youthful all my life. So they started taking them right, left, and center. And when they started taking them, there was a study which was started, the Women's Health Intervention (WHI) study, and they gave hormones to close to some 5,000 people that time, women that time, and they saw the effects. And midway through the study, they realized that a lot of these women are having endometrial and breast cancers. So that's when they stopped the study. The half-baked results of the study were released to the press, and that is where the scare regarding hormone therapy starts. Sometime in the 1980s, was when these results were out into the media, and that's from that time people think that, oh, hormones is equal to cancer, because it was so well imprinted on our minds that, oh, hormones is these they took hormones and they got cancer. But now we've come a long way from 1980s, 40 years to be kind of precise, because I was born in the 1980s. So within these 40 years, we have gone back and reviewed this WHI study. They found that the hormones were given to people, women who were more than 10 years after past their menopause. Some of them were 60 plus years of age. So today we have certain guidelines which we use for hormonal therapy. We use them as close to menopause as possible. We do not use them if you're 10 years past your menopause. We do not use them if you have a history in the family of endometrial or especially breast cancer. We do not use them if you have had some kind of um, a blood clotting issue in the past, which could be a deep vein thrombosis, a DVT, or a stroke, or maybe a heart attack. We do not use it for in such cases. So we have better indications and better contraindications of using hormonal therapy today. And now we can very safely say that hormone therapy, when used in these indicated people, is extremely helpful, not just in reducing the symptoms, but also improving your heart health, improving your bone health, reducing the amount of osteoporosis, and reducing the amount of even heart cardiac problems or cardiac diseases that women might have. So, common myths people ask me about hormone therapy. I would like to, and any other more questions, I would be happy to answer them. MHT, HRT, same things. Hormone replacement पहले बोलते थे, now they call it menopausal hormonal therapy. HRT or hormone replacement is what we call when we give it to a person or a lady who's had a premature menopause, because there we are actually replacing the hormones which she naturally should have had. Whatever the hormones we use around menopause, we call it as MHT today. I already busted the second myth. It does not cause cancer. It was a wrong selection of patients which led to cancer. Right selection of patients will not cause cancer. General mentality which people in India especially have, I don't want medicines. why should I take medicine all my life? But remember that we are giving medicine to you because there is some problem in the body which you are trying to correct. If that problem was not there, we don't need a medication. So we are actually correcting an abnormal thing by giving you something which your body is lacking. And it's okay to take it, right? It's you don't have to avoid it. If it's necessary for you, you can take it. And in fact, like I said, if you take it, it has actually much more positive effects apart from decreasing the symptoms. Yes, it improves your symptoms, but it also improves your heart health, your bone health, your uh, brain health as well. So it can be beneficial in other ways apart from just managing your symptoms. So there's no reason why you should avoid hormone therapy if it can be safely used for you. One lady had said ki, I want hormone therapy, but unfortunately it's not available in India. Of course it's available in India. We have different forms in which we can use hormones. We have tablets, we have lotions, creams that you can apply on the arm. We have vaginal lubricants or creams, ointments that we can use. We have a spray which we can use. We have ointment in a pump form that we can use. Patches are available, but we don't use them much in India because of the weather. It's pretty sweaty, so the patch may not stay or the absorption may not be correct because of the sweating. But yes, they are available in India as well. So various forms of hormones are available in India. uh, Commonly used ones are these ointments or the tablets that you can take, and we have given them to a lot of people, and they are we can see a lot of health improvements in those people also. It is not habit forming because we are not going to give it to you for a long time. Again, in those things we have learned about hormone therapy today, we cannot give it to people for more than for maybe more than 2 to 5 years. So it's the dictum is the smallest possible dose for the shortest possible duration. So we cannot it cannot be habit forming because we are not going to give it to you for a very long time. It does not cause a cardiac arrest. In fact, it can improve your heart health. So actually, if it's again, if you've had a heart event in the past and if we give it to you, yes, it may cause cardiac arrest because or a heart attack because estrogen as a hormone is a thrombogenic hormone which may cause blood clots in your body. But again, that happens only if you are predisposed to it, if you have a medical history, or if your blood test suggests something like that. So unless and until it is contraindicated for you, it is not going to cause a cardiac arrest or a heart attack as well. So this is about hormone therapy. Happy to answer any more questions about hormone therapy that you may have. This is something that I also want to speak about. That this is we spoke about what we can do for managing our health, our lifestyle, treating our own conditions. But I think the workplace can also help you by doing all of these things. Talking about it openly, and like I said, like we already spoke about it. Temperature regulation. Maybe you can have small table fans handy wherever you could use them. In those institutes or in those companies where there is a uniform to be worn, we recommend that the work there is actually a big there are these menopause friendly workplaces which is a movement which is especially started in the UK because a lot of population there is in that menopausal workplace population is in the menopausal age group. So we have norms for that, right? Norms wherein there are menopause friendly workplaces. Mental health could be affected around menopause, so counseling and confidential counseling is also something which workplaces can offer when you're talking about managing what the workplace can do for you.
I would love to jump in as well about what
Rashmi,
employers
we
can.
can't hear. I can't hear you. I mean, your voice is
Oh my,
very low.
can you hear me at all?
We can hear you, but your voice is low.
Okay, let me just increase my volume. Is this better?
No. Can you
No.
can you type it?
Jump in about the workplace and what employers can do to help as well.
I think it's better now.
Yeah.
At least we can. It's not as loud, but still, I think we can make it out.
Yes, we hear
Also,
you.
I just wanted to put this in case people are not able to hear, you can also switch on captions for yourself. So Rashmi, whatever Rashmi says, you'll be able to read through it.
I'm so sorry. I think I have probably reduced the volume a little bit on my. I'm just trying to find the settings.
But I think it's better now.
It seems
Yeah.
good now, Rashmi. I think you
Yeah,
can.
I've increased the volume a little bit. I probably
Yeah,
reduced the
better.
output. Yeah.
Yeah.
Okay. So it should be better now. So yeah, I was just going to say that I can jump in about what employers can do because I work in the employer benefits space, specifically supporting menopause and low testosterone support, including fertility support as well. So if you don't mind, Dr. Ameya, just
Please,
for a
please
couple
go
of,
ahead. I would love to hear
yeah.
about it.
Sure. So, I mean, in the slide that Dr. Ameya showed, there was a number that said, there's probably going to be more than 1 billion menopausal women around the world by 2025. And a survey that we had done at Carrot showed that nearly 54% of women considered a job-related change due to menopause symptoms. And and as you mentioned, this is the time when people are in senior female leadership roles. So the productivity cost to companies is high because they've trained and nurtured these women to these leadership roles as well. So the benefit to employers when they help women through this life stage is obviously increased productivity, job satisfaction, retention, and an inclusive culture. So there was a survey that Carrot did called the Menopause at Work survey, in which one of the main issues that came out is that menopausal women really struggle with feeling like they're asking for too many concessions at the workplace. And these are, senior management leaders themselves. So workplaces need to sort of anticipate their needs and also meet them. And the main things they can do is first create like a menopause policy. A lot of companies are already clubbing this with menstrual leave and calling it the M&M policy. And the other significant thing is create employee resource groups and support groups. Then some of these were mentioned by a doctor as well, that you can have private spaces to manage symptoms. You can modify work environments to have desk fans, coolers, or ACs. And the other important thing is you educate your male managers so their female reports and employees don't feel awkward to talk to them about this. So this would also obviously include fostering an open culture and environment where employees can have conversations about menopause. And this will also include conducting awareness programs for menopause as well. And another important thing is allow for flexible work and time off to manage around when symptoms are intense. So there will be likely trigger points or some phases where the symptoms are intense, so they should be able to take time off to deal with that or work in a different hour. The other key thing is to have providers and doctor or hospital partnerships to cover checkups and provide information through tie-ups with doctors. We spoke about hormone therapy, so we can check if companies can include it in their coverage to either subsidize hormone therapy and other treatments. So that, as doctor mentioned, not all women are a good fit for hormone therapy, but there are other medications as well, like antidepressants and SSRIs, which help regulate several menopause symptoms. And as for what you can do in your organization today, one thing is, start looking into creating an employee resource group to help you understand what the needs are and advocate for this group of women. You can use this menopause at work survey. There are many other surveys as well, similarly, about women at work that can help you collect data, and you can check if menopause care is covered in your current benefits. The insurance regulator has actually said that you cannot exclude menopause from insurance policies. But as we know, a lot of policies cover only inpatient hospitalization. So for that, you can check your out-of-pocket covers as well, whether HRT is covered. And one of the things that doctor mentioned as well is that, very few people, very few OBGYNs are actually trained in menopause care. Even in the US, fewer than 20% of gynecologists are trained in menopause care. So finding the right specialist is important. And for that, I'll point you to the Indian Menopause Society. They have a resource of certified menopause practitioners on their website. There's a list of about 400 people or so in the country, and not all of them are gynacs, but then it'll give you at least a starting place for, especially if you're living in a city, it has a list of doctors who are certified to treat menopausal symptoms as well. And in the US and UK, there's a lot of conversations happening very openly in menopause, around menopause now. The UK government is looking to support women, as well as employers in those countries are considering how to support women in this life stage. But when a lot of these companies are also partnering with companies like Carrot to support HRT coverage to help find menopause specialists, because we have a provider network as well, group support and a lot of educational material. So this is how employers are looking to support both men and women with dealing with menopausal and low testosterone symptoms. And the key thing is, you should have more conversations like this at work, at home, at doctor appointments, and with other women. So yeah, that's my pitch. I hope you were able to hear a lot of it.
Yeah, we could hear it well now. Yeah, and it was really comprehensive, including everything, right from doctor checkups to how male managers also need to be educated. I think uh, the first point which you said, right, you feel awkward asking for too many concessions. Yeah, I think that's
Yeah,
something which all
to
of
get
us
over.
probably would feel. But yes, it's natural, it's normal, and it's not a choice. So
Yeah.
I think being vocal about it is something that is really, really going to help all of us.
Rashmi, you mentioned something like what exactly is carrot?
So Carrot Fertility is a company that works with employers to provide their employees access to fertility benefits and family forming benefits. And we've also launched menopause and low testosterone support. So the entire hormonal health cycle is supported by us. So employees typically have access to educational resources and financial support via their employers. And they could use this for adoption, surrogacy, IVF, IUIs, and HRT and things like that.
Interesting. Good to know.
Interesting, yeah.
Thank you.
Further talking about how you can help and what are the resources, right? She spoke about the Indian Menopause Society. It has a list of menopause specialists in the country, so that's where you can get that information. They also have some good resources to share, some good blogs, articles. They have a lot of webinars which you can also access on YouTube, which talk about a lot of these things. And when I in the beginning when we spoke about this, right, social media, we have a lot of information, but I mean, just as we need to go to the menopause specialist rather than just a gynac who may not know as much about menopause, checking the credentials of the person talking on social media or writing on social media is also important. Because I mean, we get a lot of patients. I mean, it's a common joke. I think that we don't want to Google patient as doctors, right? Because you see everything on Google, and it's difficult to answer the queries, or difficult to convince you. Forget answer the queries, convince that no, this Google is wrong and I am the correct person, right? So that kind of misleading information should not be there. Because of which, I think it's really important for us to have the correct resources when we are using social media as well. So, of course, Ella Health has a website wherein you can check a lot of these blogs, these articles, these videos as well. We also have an app which you can use to get a lot of this kind of information as well. So, getting information from the correct. So, just as we have Indian Menopause Society, we have International Menopause Society, we have North American Menopause Society, we have the Canadian Menopause Society. So all of these menopause societies typically have the correct kind of articles, correct kind of information that you can get about menopause. So any information you want about this, go to the correct site and get the correct kind of information, and that is really again important to for us to manage our menopause. And I'm going to end this presentation thing with this video I want to share with you. I mean, it is like a silver lining towards the end, right? Things are changing and things are getting better. I hope I can share this because I couldn't embed this in the this thing. Can you see that new screen which has come up?
Yes.
Yeah. So this is something which happened on national TV on a couple of weeks ago, I think, and let's see it to and then talk about.
Let's move on to the Australian.
Can you hear?
Has the latest on the Prime Minister's visit to
Yeah.
China.
Yes, another pardon, Michael. Big chill, but the PM doesn't pander yet. So the bilateral meeting between Australia and China, Anthony Albanese and and Chinese. I'm so sorry. I could keep stumbling through this, but I am having such a perimenopausal flush right now. Live on air. I'm so sorry.
Imogen, the point about these is that we need to make it normal to have these kinds of conversations. And I love you for even saying it because we interview people, we talk to people about this, and this is the reality.
I don't think hormones respect national television.
Yeah.
It's the furnace of the sun.
Yeah.
Sorry.
Well, listen, we'll let you take a breath.
Oh, it's
And,
fine.
thank you
The
for being 100%. Thank you for being honest about it. We can, and while Imogen takes in some deep breaths, listen, we want to throw.
Right, that's how he kind of he urged her to take a break and go through it while he spoke about something else. So this is something that can happen. This happened on national TV, and I think we have come a long way from people not knowing about menopause to people actually talking about this and being open and candid about it. So I think there's hope, and I think we are going to actually go there and make these conversations very very natural and normal. I don't know how to get back to the presentation.
Just the other tab.
Actually, I can't see, there's a black thing in my
Okay, I think that's pretty
that
much.
was the end of it. So yeah, maybe I'll stop sharing.
I think
You
we have
can
a couple
try
of people
thinking that.
who have put in questions, and we could take them. I'll
Yeah.
start at the top. Okay, so I think one of the questions was how long do these symptoms, the perimenopausal symptoms, exist, and how long do they stay? So I think
Like I spoke about that, right? Some of these symptoms can disappear after some time. Some of them may actually increase when you're going into your menopause as well. But on an average, they typically last. Things like hot flashes, things like mood swings, things like yeah, these things typically stay around your menopause. The skin issues again stay around your menopause. Some other things like vaginal dryness or mind fog may increase after menopause. For some, not for all. So I don't want to end on such a negative note, but yes, at times they can stay for a longer time also.
the next question we have was from Preeti. She's saying, I am 41 and in my perimenopause, facing a lot of these symptoms. Life is difficult as no one understands what one is going through. I want to know about the supplement support we can get.
So when we talk about supplements, first of all, get your vitamin levels checked. So we recommend a routine test, routine panel of tests to be done around your around the 40s. So good you brought this up. So I had missed this point. So one is the blood tests which we need to do, which is everything starting from your complete blood count, giving your iron levels, your hemoglobin levels, your liver function, kidney function, your cholesterol levels, your sugar levels, your urine test, a stool test also. All of this is what we recommend around menopause. We also recommend a pap smear, which we recommend much earlier on, since you've had your sexual debut or since you've started having intercourse. Once to be done every 3 years, the pap smear. A mammography is what we recommend once a year or at least once in 2 years after the age of 40, and a sonography as and when required. So these things will help you to the blood test especially will help you to understand where you stand in the where your thyroid hormones and your vitamin B12 and D is concerned. Certain times certain directed hormones, the directed medicines need to be taken for these kind of vitamins. Otherwise you can go for supplements which have a multivitamin content in them. Just to add here, Elda Health, we've come up with these products as well, because I myself work with a senior product developer, researcher and we saw the most common symptoms of menopause and how we could manage these symptoms with something which is not really hormonal, much more herbal or much more natural, which we can continue taking for a longer time as well. So you could check out those supplements also at eldahealth.com in that shop page for Elda Health. Otherwise, we have a lot of multivitamins which we should take. Calcium is something which we should take, and we should take it from before you get close to menopause, because that's the time our body absorbs calcium better when estrogen is present, and that's when we can maintain a good bone reserve of calcium, so that we don't have the effects of the lower density of bones. So calcium is something, multivitamin something. Check your iron levels, because sometimes people have a lot of heavy bleeding, so iron supplements might be required for those people also.
Okay,
So these are the basic things that you can have.
the next question we had is from Nani. She's asking, can you talk about Mirena and similar treatments, especially for those with a history of stroke?
Yes. So when we talk about hormonal treatment in patients with a stroke, we want to avoid estrogen, because, like I mentioned, estrogen is the thrombogenic hormone. Thrombus is a blood clot. So anything that makes or helps to form a blood clot is a thrombogenic medication. So estrogen is thrombogenic. So we want to avoid thrombogenic hormones, which is estrogen in such patients. Mirena is something which is an intrauterine device, just like a copper T, which we also use for contraception, but the same structure, but it releases a hormone, the hormone progesterone, every day, about 20 micrograms of it every day. So that can be used for treating especially your bleeding issues. I think I skipped talking about the period problems that you can have around menopause. Could be scanty bleeding, heavy bleeding, etc. So in case of heavy bleeding, in case of adenomyosis, Mirena is something which can be very useful. And although it's not exactly what I would say a hormone replacement therapy for symptoms of menopause, but yes, it can be really, really helpful for patients with a heavy bleeding history to decrease the amount of bleeding.
The next question that we have, and I think it was answered, was around HRT. So
Yeah,
we can
I
about
think I
that.
spoke about that in detail.
Yeah.
Yes.
Okay. And I think
Side effects post. I maybe I'll just go through the questions and answer them
sure.
because we are already late and above time. So side effects post application of Mirena, nothing. Please use it without any kind of this thing. Some people may have some increased water retention or slight increase in weight when you're using Mirena. Some people may have a little increased amount of mood swings or depression, sadness with Mirena, which can be managed by other medications as well. So some very common ones could be these two, so weight gain and mental, I mean, what is it? Mood swings could be because of could be one of those, a few of those side effects of Mirena. I there's one more link which you can access for. I was the same link, I don't know, but this thing that we the video that I played. The next question is, what are the must do things to be done on a regular basis for long term wellness? I think I spoke about those 4 pillars. Remember those 4 pillars: nutrition, exercise, sleep, and exercise.
Um, Amya, I had a question.
Yeah,
Uh,
the four do's you have mentioned, Sweta. Thank you.
yeah.
Do, delay, delegate, and delete. Yes, yes.
So, as I look at a lot of my friends, right, a lot of us are in our mid 30s, and that is when a lot of them are choosing to have their first child. Okay. And I remember that first slide you had, one of those slides you had, which said that perimenopause can begin from 35 onwards. So it seems like the point when a lot of us are now deciding to have children is when perimenopause can hit, and it feels like double bind, right? So
Right.
so what would you recommend women do in such a case?
Yeah, yeah. So what we say is 30s is fine, like early 30s is great for having a child, but even medically we say when it's post 35, we consider this as a slightly higher risk pregnancy, because the ovarian follicles are aging now. Because of these aging follicles, we have a higher risk than normal of having any kind of abnormalities in the child as well. And second thing is inability to conceive as well, because of the lower lower ovarian reserve, or lower number of follicles, or lower quality of follicles that we can have. What we do recommend at such times, it is becoming very pretty common these days as well, is that if you're anticipating a late pregnancy, you may go in for egg freezing in an earlier time. What I want to stress at this point is a lot of times we are so caught up with life that when we are 35 we realize, oh, I need to freeze my eggs. At 35 the quality of eggs is not, the quality and quantity of eggs may not be great. So in case you are anticipating that yes, you may not be planning a pregnancy soon, if you want to go for egg freezing, it's completely safe. It will involve injections, hormonal injections, etc., but the effect does not stay for lifelong. It's only that time of the cycle where that effect stays. Like freezing is extremely safe, and you can plan to do it a little earlier in your 30s or late 20s itself, so that you can be relieved and plan a pregnancy whenever you want to plan one. Another thing is, what I would say is that in case you are planning to conceive after 35 and you have not done it, you've missed out on the egg freezing and you want to try natural pregnancy. Normally we say 1 year of no pregnancy after normal regular intercourse is when you should see a doctor. But if you're 35 plus, maybe try for 3 to 6 months. In case you're not able to conceive naturally, good time to go and consult your gynec about what needs to be done, because what happens is the ovarian reserve goes down pretty slowly. So if you are seeking help early on at a correct time, there are many ways in which, without even IVF, freezing, etc., you can plan a pregnancy soon. So only, and this is, I mean, it's like every body is different. So we've had people getting pregnant naturally at 40. We've had people having problems at 35 or 33, 32 also. So, in case you're anticipating a late pregnancy, a best thing would be to go and talk to your gynec. We do a test called as the AMH, or the anti-Mullerian hormone, which helps us to understand your ovarian reserve. And based on that, we can advise you whether it is okay for you to delay your pregnancy, whether you should go for egg freezing, whether you should go for a pregnancy right away, depending on what life situation you are in.
I think that's very, very helpful. I'll also open the floor now for people to ask direct questions in case they
Sure.
have any, and I'll stop the recording. I think there was one question where someone wanted to consult you personally. So they wanted to know how to reach you in that case.
Can you please download the Elda Health app, or maybe